On Monday, the state started rolling out its plan to get the COVID-19 vaccine to children as young as 5 years old. The planning came even before the FDA decision on whether to give emergency use authorization for the kids' vaccine. Texas officials expect the vaccine rollout to be smoother this time, in part due to a Biden administration rule allowing for pre-orders of vaccine supply. Once authorized, the first shipment of doses will be sent out within 5 days. Pediatricians are a key part of the state's plan.
They're pre-planning that in advance so that vaccine is available as soon as it can be. It was thought that they would primarily be distributed through pediatricians' offices and through pharmacies. And my understanding is that there's some planning on some school-based clinics as well.
There are about 2.5 million Texas children between the ages of 5 and 11. That group will need new vaccine supplies beyond what's already out there because those children are supposed to receive smaller doses. Texas is already set to get about 1.3 million doses of the pediatric vaccine and will be able to order more. Pediatricians are gearing up to give those vaccines, but politics reporter Daniel Marin found there are still questions about the plan.
Pediatricians are nice just in that you have a relationship with your doctor. You can talk about concerns with the vaccine.
Austin parent Anna Krejci says she's found when it comes to getting her kids their childhood immunizations, it's just a much smoother experience to take them to the doctor they've known their whole little lives.
It's not the easiest thing to do with a small child.
With COVID vaccines likely around the corner for 5 to 11-year-olds and Texas set to receive 1.3 million doses, the Department of State Health Services says pediatricians will play a big role in getting shots in arms.
So we're gearing up and we expect to be vaccinating children very soon.
Austin Regional Clinic says it's been preparing and is confident its staff will be ready.
This is a standard vaccine injection, no different than any of the other vaccines we give children.
But Dr. Samuel Mirops says for his smaller shop, when it comes to COVID shots,
it's a lot more complicated. After you get the vaccine, just like grown-ups, you have to wait for 15 minutes. And for us to try to do that during our regular office hours, we only have so many exam rooms in the office.
Daniel Marin joins us now. So we know Texas is getting more than 1 million doses. Any idea how many of them will end up in pediatricians' offices?
Well, the state didn't really have that number available immediately, but we do know that there are more than 4,000 providers signed up to administer COVID-19 vaccines in the states. Last week, DSHS said 814 of them had already pre-ordered Pfizer's pediatric doses. Those pre-orders are required to be a minimum of 300 doses.
Has the state signaled how it plans to reach out to parents who are reluctant to get the vaccines themselves, let alone give it to children?
Well, DSHS has already rolled out some media campaigns trying to reach those parents, give them some information on the efficacy and safety of the pediatric vaccine. Keep in mind, though, that it is going to be a much smaller dose than those given to older children and adults. The state also says that it's coordinating with community-based organizations that have direct contact with these parents. They see them every day to try and ease their reluctance.
Well, you covered another big health story this week with implications for Texas, opioids. Tell us about that one.
Yeah, Attorney General Ken Paxton announced that Johnson & Johnson has agreed to a $290 million settlement as part of claims that its marketing practices contributed to the overall ongoing opioid epidemic. And as we've reported, 70% of that money will go into a special fund set up by the state legislature to pay for things like treatment, addiction prevention, anti-withdrawal medications. This week, I chatted with a local social worker and rehab therapist, and he gave me a long list of things that he thinks the state could spend this money on. And one that stuck out to me was retraining medical professionals so that they stop using opioids and use other pain management techniques. Take a listen.
Opioids are very good medications for many types of pain and are likely to continue to be first-line solutions, but not for other types of pain. So whenever it's possible for us to use other types of medication that can be as effective at managing pain, we should do so.
And Attorney General Paxton says that Texas should see this Johnson & Johnson money by January 1st. We do need to point out J&J says that this settlement is not an admission of any kind of wrongdoing.
All right, Daniel, thank you very much. Johnson & Johnson is one of 4 companies involved in settlement talks over their role in the opioid crisis. The others are AmerisourceBergen, Cardinal Health, and McKesson. They're all pharmaceuticals distributors. Texas expects to receive close to $1.2 billion from those 3 companies. The agency that regulates natural gas producers in Texas reports new progress toward preventing power outages like what we saw last winter. Why one state official says regulators are ahead of the game.
Do you agree that climate change is real?
Yes.
Top oil executives testify on Capitol Hill on climate change and say they agree that burning fossil fuels is the main cause. How they're responding now to lawmakers' calls to take action.